Well, great. Thanks for the nice introduction. It's a pleasure to be here. A few thoughts to start. One is how wonderful is this? Human beings in 3 dimensions gathered together and talking and sharing ideas and asking questions. And so this is actually my first larger patient event in 3 years. So it's just so looking forward to being here today and sharing my thoughts and sort of hopefully giving you all a few items to take home and use in your MS care. Another thought is I've kind of gotten to know the group down here at Norton over the past few months, kind of this program we did a few months ago, and yeah, what a great group and what great energy in the neurosciences generally, and then MS specifically. Also, I thought before we get into the talk, you kind of heard that all that education, training, many years doing that. I actually started in Colorado, where I am now, and the kind of backstory to my career is I grew up in Colorado in the 60s and 70s. Even then, back then, people in Colorado used a lot of marijuana, and they liked their exercise, and they were very fit with the diet, and they sometimes used other unusual foods and herbal products. And then I left after high school, and then I returned 20 years later with all that training, and I thought, I've got every toolbox I could possibly have, and then I'm going back to my home to share all of this. And I was so humbled, really like in the first few weeks, because I didn't anticipate this, but they were asking me, should I smoke pot? Should I do yoga? Should I take these unusual supplements? And I had actually gotten no training in all of that. And at that time, 30 years ago, when we had no effective disease-modifying therapies, those were the critical things people were thinking about. So that became my career. Take all the academic rigor I'd learned, but apply it to those day-to-day questions in clinical practice. So that's where this talk comes from. It's from the heart. I grew up in Colorado, so all those things are deep in my bones that my patients were asking and patients asking around the country at that time and still. So what we're going to talk about is this integration, bringing together conventional medicine with alternative, with lifestyle approaches. These are my disclosures. So we're going to talk about this newer paradigm. It's not brand new. But it's newer, this integrated medicine paradigm. I think it's still not well understood, so I really want to spend some time on the definition and then talk about these 7 concrete steps you can take and where you can go for more information. So this integrative approach, it's a little contrary to, or is very contrary to the current American health system, which is very disintegrated or compartmentalized. You have very sub-specialized people taking care of your MS, or if you have lung condition or heart condition. It's really sort of organ-specific care that kind of disintegrates the care. But it's blending lifestyle, unconventional, conventional, and doing it in an evidence-based way, not trying to sell products, really not just doing evidence-based approach like we use with conventional medicine. And then the 2 other elements, I think a lot of physicians aren't familiar with these 2 other elements. One is to think about health just as much as disease. You know, we talk about the American healthcare system. It's really primarily a disease care system. You don't get much attention in it unless you have a disease. So it's really not, there's not a lot of emphasis on preventing disease. And then the only way to do all this effectively, it can't be sort of a paternalistic physician-patient model. It really needs to be collaborative, and you already heard some discussion about shared decision-making, but yeah, it really is this partnership, physician and patient, clinician and patient. So how do you take all of those elements, apply them to MS? This is a 7-step approach. There's a lot there. I'm just quickly cover it here, and then this is actually we're going to spend most of the time talking about, but disease-modifying therapies, actually going to say nothing about those. You just heard excellent talk on that, but then diet, physical activity, emotional health, tobacco, alcohol, preventing other diseases and managing symptoms. And I like this wheel, and this really emphasizes No matter how good you feel or motivated in these different areas, you really need to be doing all of them to some degree. And to me, it's really not whether you're getting a B plus or an A in these different categories. It's that you're putting effort into it, and you're doing that on an ongoing basis through your life. So let's talk about the integrative piece. Like I say, American medicine often is disintegrated. So the blind men and the elephant, this is often, I think, how you can feel in our healthcare system. No one really knows your whole body, and the body is interconnected. It isn't individual organs just sort of independently sitting there. You know, the brain is connected to other parts of the body, sometimes quite importantly. And then talk about lifestyle. You know, sometimes I talk about lifestyle, talk about lifestyle medicine, and some of my colleagues say, that is so cool. Did you make up that term? And it's actually a term that's been around for 35 years. There are 1,000-page textbooks on lifestyle medicine, but that kind of indicates that it really hasn't permeated deep in the American healthcare system. So I think the connection to MS, this is the most clear. So a lifestyle factor like exercise could have a positive or negative effect maybe on the disease course or symptoms of MS. I think what's thought about less, and this is actually more of an integrative approach, lifestyle in a positive or negative way can determine whether you develop other diseases. Physical activity might prevent diabetes, or no physical activity might mean you have diabetes. Having one other chronic medical condition like diabetes can then have a negative effect on MS. So I think this is sort of a diagram that needs to be more incorporated into day-to-day management of people with MS. So comorbidities, I don't really like that term, it sounds kind of awful. It just means other medical conditions that you have. But the most common are mental category, depression and anxiety, but a lot of people with MS have high blood pressure, cholesterol, arthritis, other issues. Pretty long list of the common other medical conditions that people with MS have. In these other medical conditions, even one can negatively impact MS with lower quality of life, worsen your disability level, rapid increase the rate of disability progression, and also potentially increased risk for attacks and new MRI lesions. So I'm not going to go through this in detail, but I'll tell you what this table is about, and I think it's quite striking. If you just go across the top, risk, that means the risk of developing MS, and then risk, the next one is risk for attacks, new MRI lesions, next is disability worsening, the last one is worsening your symptoms, and then you go down the list on the left, there are actually 8 factors there. So on the nutrition side, you've got vitamin D level, quality of the food you take in, obesity, and then exercise, emotional health, alcohol, tobacco, and then the comorbidities or other medical conditions. So you can see at this point, most of those boxes are filled in, that those 8 factors can potentially impact risk of MS, but also how MS plays out over time. And the impact level of some of those factors can be in the 20 or 30% range, which is in the range of some of our MS medications. And then this is an important part of the equation. So how do people do maintaining a healthy lifestyle? This is a study published several years ago in the Mayo Clinic proceedings, looked at the US adult population. They just looked at 4 factors. So healthy diet, exercise, tobacco, body fat percentage. 2.7% of Americans had all 4 of those. So I think in this area, and I say some variation of what I'm going to say now a few times per day in my clinic, that knowledge is not always power, or it's difficult, but it's not complicated. So I'll have patients, for example, come in with some elaborate diet regimen they've come up with, or some kind of crazy, very detailed exercise program that's really kind of excessive and has lots of bells and whistles, but really not critical to do all of that. So, that's makes it's complicated. If it starts feeling complicated, you're probably pushing too hard. The difficulty is not knowing what to do, it's having the motivation drive to do it on an ongoing basis. So with COVID, I thought this older quotation, what I think is still true even after COVID. So lifestyle disease epidemic causes a much greater public health threat than any other epidemic known to man. So this is huge. The health impacts are much bigger than what we've seen with a pandemic like COVID. And then people with MS in this area, I said 2.7% can follow the lifestyle factors. People with MS can, it's kind of a twisted way to think about it, but have kind of a gift, have a motivating factor, which is actually the MS diagnosis. So there's a patient of mine who's in his 60s now, but he said he lost about 5% due to MS, but he gained much more than 5% over the past 30 years because of MS-induced or MS-motivated lifestyle changes. Early in my career, I heard patients tell me this. Actually, in my training, the first MS patient I met 35 years ago said something like this, like MS is one of the best things that happened to me. And I thought she had some kind of psychiatric condition, like how could you possibly think that? And she actually was not very educated, but she was wise, and she was wiser than me, and she was in her 70s, and after I kind of heard what she was saying and saw her family come in, I knew just what she was talking about. So some research I find does not resonate. My heart is in the clinic, kind of on the front lines with our patients, and some research does not really kind of fit with how I experience MS in the clinical practice. This study, though, I loved, and it just so resonates with what that last patient said, and at this point, hundreds of my patients. So this is a study, it was published in 1994, a little over 100 patients, and they looked at people who had successfully made lifestyle changes that were enduring over their lifetime, like diet changes, exercise changes. And the people who were able to do it, it was not New Year's resolution, it wasn't a book, it wasn't a TV show, it was these crystallizations of discontent. And they really formed that term based on hearing these 119 people talk about how they'd made a successful change. So characteristics of this crystallization is intense emotion, negative emotion, some external threat, often related to health, and just a focal, discrete event. And when I read this paper, I was like, oh my gosh, that's my office when I diagnose someone with MS. And wow, that's what I feel, that's what the patient feels. And then the whole paper made sense to me because I'd already, by the time I got to this paper, I'd had dozens of my patients also tell me MS was actually this great motivator for them to live a healthier, more meaningful life. So we'll come back to that later in the talk. Also, we'll talk about unconventional treatment. So it's also known as complementary and alternative medicine, or CAM. You'll see that on some of the slides. So general population use of this is about 40%, higher in people with MS. And most people with MS in the general population don't just use unconventional therapies. They blend it with conventional medicine. Very importantly, these can be helpful. That's true. They should be incorporated into care. Some are not effective. That's kind of a waste of time and money. And then some can be harmful, and many clinicians aren't aware of that, and that should be part of the conversation in the clinic. If something's potentially going to harm you, worsen your MS, you need to know about that. And then now we'll talk about the other part of the definition, this health and wellness. This really is unfamiliar. I got zero training in this. I like to think outside of just treating a disease once someone developed it. And that gets back to this. So wellness, a lot of this health aspect relates to someone's lifestyle approaches. And then the clinician-patient relationship, that's also, like I said, something I didn't get much training during formal training in, but this cartoon kind of highlights it. Give it to me straight, doc. How long do I have to ignore your advice? So I think there's a lot of work that can often be done in terms of clinician-patient connection, and then also accountability. Some things like lifestyle, the accountability on the physician-clinician side is to give you the appropriate information, but then it's your accountability to actually do that. I love this quotation. I think of this many times every day in the clinic, that healing is not a science, but the intuitive art of wooing nature. And I think that each person's body is different, each person's MS is different, and how do we work together, clinicians and patients, to woo that person's body, use what they have to kind of optimize their health, optimize their life. So these are healthcare providers' qualities that can help with that. So someone who's positive, reassuring, encouraging, develops trust. I think our current healthcare system, where there's very little time to see patients, there are obligations maybe to order tests. I won't get into all the details, but that doesn't relate to these positive healthcare provider qualities. So now let's go back to this. We'll now go down through these different steps here. So step one, like I say, you already heard outstanding talk on that, so we'll go straight to step two. Step 2 and 3, the diet and exercise. There's a whole panel this afternoon, so I'm going to try to plant some seeds here, but I don't have that much time to talk, and you'll have a lot of time to get your own questions answered, but I'll kind of have, there's more busy slides than I have time to go through, and that's a little on purpose. As you go through the, you can see how varied these elements are of the integrative care approach. So with diet, there's lots of controversy, a lot of confusion, and like I say, this is difficult, but it's not complicated. I'll come back to that. So I hear this often. This is often, I have people come to me for a second opinion because they've been told diet has nothing to do with MS, and they're just kind of confused. They go on the internet, they can't quite make sense of it, but they can't believe that what the food they take in doesn't impact any aspect of their MS. So that's definitely not true. We'll come to that, and that relates to this. So someone eats an unhealthy diet, you know, that outward loop there, the one on the side, the kind of indirect loop, unhealthy diet, diabetes, high blood pressure, heart disease, stroke. Some of those are actually caused by unhealthy lifestyles. So lifestyle-induced other medical problems, we know that those negatively impact MS. The exact, on the lifestyle side, the diet that is the best and worst for MS, we're still working on that, and that I'm sure will come out this afternoon. I got this, so here's the million-dollar question. What's the best diet? I just advanced a slide. No one knows. So I don't think we're ever going to have the best diet for MS. I'd be stunned if we do. And we'll come back to that. What's the worst diet for MS? We do have an answer here. Standard American diet. And so you really, you know, if you look at other medical conditions like diabetes, high blood pressure, high cholesterol, they're 30 years ahead of us in terms of looking at diet impact on those medical conditions. And there isn't one best diet for any of those conditions. There are many that can work. And so that gets to item 3 on this list. So to me, this is what I coach my patients on, and we work with them on an ongoing basis. But the best diet for MS, I think, is that number 3. That's Michael Pollan, who went through all the generally healthy diets and summarized them in this brilliant 7 words. Eat food, mostly plants, not too much. Or you can follow particular diets, you know, Mediterranean diet, there's a TLC diet, flexitarian diet, or if you want to have sort of feel free with what you're doing, whenever you're having a meal, you just think of those 7 words. I put an extra word at the end. It's a little out of alignment here. But enjoy. You've got to enjoy the food to sustain it over time. And I think sometimes that's a project. I think some people on the standard American diet make this rapid switch. They totally hate the food, but they have some inner feeling that they're doing good for their body. You really need to have those come together. Maybe make a slower switch, work to find healthy foods that you enjoy. The other items on the list, in the area of people think about diet and MS, and then they start thinking, well, which supplements should I take? And it's really, That old shotgun approach, taking supplements, that's really not what you should be doing. Many supplements in modest doses can actually have negative health effects. To me, you really do need to be mindful of vitamin D and vitamin B12, and that's probably it. And then there are more than 300 supplements that could be harmful to people with MS because they activate the immune system, they may negate the beneficial effects of disease-modifying therapies, may worsen symptoms of MS. And then the last item, which it's a lot easier for me to bring this up here than in my office sometimes, but your weight management. You know, we have lots of studies indicating that weight management, that's certainly going to help your symptoms of MS, improve walking. If you have walking difficulty, might have an effect also on the disease course, will certainly have an effect on getting other medical conditions. That's a challenging conversation, though. Someone has disability, they can only burn so many calories with physical activity. The flip side, I'll say some of my patients with high disability who lost weight primarily through diet have told me that was the best intervention ever for their MS. And these are people kind of 20 or 30 years into MS. Now I'll move on to physical activity. Like I said, just a few words here. So the pioneer in this area was not a scientist or clinician, Jimmy Huga, an Olympic skier from Colorado who developed MS after he won his Olympic medal. And he was so convinced exercise was helping his MS that he sort of started a whole program in Colorado. Program's now called Can Do MS. So physical therapists are really the best ones to help you with this. As with diet, there's no best MS exercise program. And in general, 3 to 4 days a week, 30 to 60 minutes per session, 2-to-1 ratio aerobic to strengthening, also stretching, balance, and what's often left out in American programs is just enjoy those relaxation molecules you get with exercise. Just lie down on the floor during or after exercise. That can be a big motivating factor. So it's kind of an amazing list. This would be a blockbuster drug if it was a drug. So you can just see all the physical, emotional benefits for fatigue. This is one of the better ways to prevent MS fatigue is to have a regular exercise program, a lot of other MS-specific benefits, but also general health benefits. And lots of ways to do this. And actually, part of my, what I find interesting doing this integrative medicine approach is I actually talk about fun. The word fun never came up in my very long years of medical training. And, but if you're having fun, if you're enjoying something, that's going to sustain it. So you can do conventional exercise, but also water therapy, a little outside the box, yoga, tai chi, Nordic poles for walking, sort of more of a full body workout and more stability when you're walking. Dancing, Pilates is great for core muscles. Hip flexors often are weakened in people with MS. High intensity interval training sounds very intense, but it just means you do whatever a sprint is for you, and this can be people with significant walking difficulty. We just do 5 sprints with 2 minutes kind of in between them and a 30-second sprint, and then lots of other approaches. Personal and social well-being. So this is sort of an aggressive approach here. I'm learning to relax, doctor, but I want to relax better and faster. I want to be on the cutting edge of relaxation. So he doesn't get it. And it can take a while. You know, within our culture, we're so type A, kind of pushing so hard that it can take a while to kind of get out of that cultural norm. So this is an ambiguous area. It's not just if you're stressed or non-stressed or if you're depressed or not depressed. There's something deeper that happens with all of us hour to hour, day to day, and it's sort of, we're having emotions. Some people are more aware of them than others. But this emotional literacy, which is very low in our country, but you identify and process the emotions in real time. And if you do that, that's a great way to actually prevent stress and prevent mood issues. We've had lots of success with kind of older-fashioned psychodynamic psychotherapy, really trying to teach people like you do in a gym. How do you work with your emotional fitness? And then this is actually a male patient at the end here, diagnosed at age 25, recently married. He's now 40, but he kind of in his 20s, MS forced him to do a year of psychotherapy and some intensive introspection for a few years. This helped me, also my family. His family comes in. Kind of amazing to see, kind of deer in the headlights at 25 and 35 young kids with him, and it sort of rippled through his marriage and then the family, the fact that he was more emotionally connected with them than he had been before, with his wife than before an MS diagnosis. Lots of ways to do this: spirituality, exercise, blending the two, things like yoga, tai chi, relaxation approaches, alternative medical systems, traditional Chinese medicine, Ayurveda, yeah, and then psychotherapy, and also using friends and family to try to understand yourself, try to understand your emotional self. And then tobacco and alcohol, so variable findings, but generally MS is about reason 353 to not smoke. Not surprising. It generally shows a negative effect. Alcohol, we don't have definitive negative evidence, but certainly moderation or less. So that's 1 drink a day for women, 2 for men. That might be coming down somewhat. And they can be bunched on the weekends. I was surprised recent recommendations, which I think ultimately in my patients often lead to less alcohol, is to just take a break on the weekdays, and then you can actually bunch up more than the gender-specific maximum amounts on the weekend, but certainly not excessive. And this can be hard to break. So talking to that guy on the left about cutting back on his beer, that's going to be a hard conversation. And the guy on the right with his smoking. So these are deeply ingrained habits that are not totally hardwired, but they get in pretty deep. But I was talking about that crystallization of discontent. I've seen this many times. This is a patient of mine. He and I do some talks in the Denver area about the potency of this crystallization of discontent. But he said in the 1990s, and that's when I met him, had multiple addictions, including alcohol and marijuana, also diagnosed with MS in the early 2000s. MS became the motivating factor for me to clean up my life. MS is still a daily motivating factor to avoid my addictions. And when he gives talks, he talks about how he feels this sort of primitive draw to his favorite addictions, but then it's sort of squashed by him having MS and thinking he wants to do the best he can for his MS, for himself, and for his family. And then of all these other factors, this is the most important one. So preventing and managing other medical conditions. So really trying to keep the rest of the body healthy. And the best way to do that is to do these other factors: diet, physical activity, emotional health, don't smoke, alcohol in moderation. Symptom management, this is gigantic. To do symptom management with conventional lifestyle and unconventional medicine, that's really big territory. I have covered that in my writing, kind of going through each MS symptom, what could help you with conventional medicine, unconventional lifestyle approaches. For this talk, I'm just going to show you the richness and the potential of some of the therapies that are out there. So I'm not thinking you'll take in the whole slide, but you have common MS symptoms across the top: bladder symptoms, fatigue, walking difficulty, pain, and you can see all the non-drug options out there where we have at least some evidence that these can be helpful. The 2 most common other medical conditions, anxiety and depression, there are lots of non-drug approaches there. And then what if you flip it? Look at therapies across the top. Like I say, exercise, it's just kind of amazing. So therapies across the top, and then the potential symptoms. You can see sort of exercise is the winner when you use this approach, unconventional exercise with Tai Chi and yoga, lots of potential benefits there. And then mind-body approaches, guided imagery, meditation, mindfulness, lots of potential there. So how do you put all of this together? You know, I think the challenging areas for me, and doing this in a gender-specific way, so there's some stereotyping here, but for men, I think that emotional health, emotional literacy, that's challenging. There's an opportunity there, but that's kind of hardwired in. It's really hard to kind of access that, but the jolt of an MS diagnosis, I've seen that dozens and dozens and dozens of times that that's sort of, at age 25, what wakes up a man to think, I actually do have some feelings, and maybe if I understood them, I can work this disease out better. And I talked about the challenges with tobacco and alcohol. For women, you know, it's sort of a stereotype from a very long time ago, but you know, women generally less physical than men. I think that still can be the case. If MS takes away some physicality and you don't have an understanding of your physicality to begin with, you can't do like 4 weeks of physical therapy and you're all good to go. It may take a year or two to build the physicality toolbox. Like men, it may take a couple years to build an emotional toolbox. And then weight management, that can be a challenging area to address, even though it can be very rewarding for many people. Progressive MS, you heard earlier, we don't have any treatment options for it. I find there's a lot we can do on a non-drug approach, going through those 7 steps that I've talked about. Aging, I think this is interesting. I've seen this in so many of my patients who are now in their 60s and 70s. You just heard the talk about aging, but I thought this is really interesting. There are actually studies to support this. I first just kind of saw it casually in my practice, but MS was an opportunity for me to feel aging early, motivated me to change my life and my habits. MS has had a profound positive impact on how I've lived my life for the past 20 years. So this was from several years ago, so he's now mid-70s, and he's got it going on. I've followed him for 25 to 30 years, and they're really kind of striking, and he's definitely someone who feels like has the most optimized health of any of his peers or family members similar age. Talking about these crystallizations of discontent, sometimes that can have a certain impact when someone's diagnosed, but then when someone has an attack, you haven't had an attack for a few years, that can be another jolt that can be used to sort of, after you kind of get through the initial trauma of it, to say, well, is that going to lead me to do some things differently? Similarly, I used to feel very disturbed when a patient came in and said, my primary care just diagnosed high blood pressure or high cholesterol or diabetes, heart disease, obesity, and they say, I'm probably going to go on medication unless I make some lifestyle changes. And I'm sort of empathizing with them, but I'm also thinking, oh my gosh, here's the opportunity. Like, this is a double benefit, so maybe this is going to be the driving factor. We've been talking about diet and exercise for 10 years with MS that they've had, but now there's a whole nother reason to do some of the lifestyle things they have not been doing so well. Also, people going off on unemployment or disability, that's a great time to kind of get these things going. In the pandemic, I had patients kind of go both directions. Some, during pandemic, home a lot. Some were like totally on it, like they really like perfect with their lifestyle approaches. Some kind of fell off the wagon. So it's really, like I said, a lot of self-monitoring to really make these things happen well. And then I picked out just, I have some books in our waiting room. I was talking about an education program last night, but we have these books that have no writing in them, and there are pens there, and have my patients fill out pages, and so my pages are sort of writing collective books about MS, and this is just from the pages of those books, and these are patients I know who are 20 plus years into MS. These are what I'd call people who are just masters of what I've just talked about. So one, getting the diagnosis is scary, but the unknown is scarier. Once you know, you can tackle it and start making changes to take care of yourself. One day at a time, breathe, and small changes have big effects. My best advice, become educated, listen to your body, live your best life every day. And then the disease is not one size fits all, so take care of yourself and give yourself time to know what works for you. So yeah, it really is the snowflake disease. Sounds kind of corny, but the disease process itself might be a million different subtypes of MS, literally. But then the person it's in, sort of their body, their mind, what therapies are going to be most helpful for you, most appealing to you, that's really individualized. And you really need to that's not something you're going to figure out in a month, and it might change over time. So a few final thoughts here. The human body's amazing. Like, I've got this amazing computer here, but our bodies can do things computers can't do, but there's also no owner's manual for our bodies. It's like, how did that happen? But so amazing machines, and we have no directions on how to use them. So when you're making lifestyle changes, small, consistent changes, that powerful motivator that a diagnosis can be, lots of non-medication approaches, you don't really want to get honed in on one approach. And I see that in some of my patients who are athletic to begin with, and they put all their effort into the physical activity side, and they don't pay attention to diet or especially their emotional health or the other factors we went through. Kind of be your own advocate, be accountable, and then sort of use this maybe at a younger age than you would have otherwise to find true kind of joy and meaning in the activities in your life. So I've written a lot on this, so this is a book that kind of covers in a whole lot more detail what we've talked about here. My website has hundreds of pages of free information if you want to go there. Worked a lot with National MS Society, so there's information there on these approaches, and then lots of organizations and colleagues who've helped me with this, and probably to get it all to this point, the largest number of contributors have been people with MS, so thousands of my own patients over 30 years, but probably equal number who are not my patients, but who have sort of sent me emails or old-fashioned letters or called just telling me what they've found helpful or not, and that's sort of built up this, the database of information I have and have shared with you today. So I think I'll end there, and thanks for your attention.